I'm the interim chair of the CQC. If you'll forgive me, I think I ought to introduce why I am sat in the chair today. As reported at the last public board meetings, Professor Sir Mike Richard has resigned as the CQC chair earlier this year. Because the new chair appointment is taking longer than was originally envisaged, for personal reasons, Mike gave notice of his intention to leave as of the end of May. I'd just like to say again, I know we mentioned it last time, to express our thanks to Mike's contribution to the CQC, both in terms of the Richards Review and also his role as chair. We have marked this obviously with a card and a small token of our appreciation for that. The new Secretary of State is still to announce his preferred candidate as chair, which will go to a pre-appointment hearing for approval by the Health and Social Care Select Committee. So I've been appointed interim CQC chair while we await this announcement. Some people may know we are also progressing with recruitment for a permanent chief executive of the CQC. This is still being progressed, but continued delay of the chair is regrettable. We are continuing to liaise with the Department of Health and Social Care in the hope that this will be resolved as soon as possible. So I just wanted to explain why I was sat here, and now I'd like to dive into, we've got really loads of important things to get into. So if I can go straight to it, we have apologies from Michael Meyer and Chris Zaziki. Welcome to Julia Corrigan-Davis, who's joining us as a representative of the Carers Equality Network, and Sue Seska, who's our trade union representative. For the public record, I would just like to confirm that Professor David Crosdale-Appleby has been reappointed as the chair of Healthwatch England and a non-exec director of the CQC from the 1st of June 2026 to the 31st of July 2027, or until Healthwatch England is disestablished. And Richard Barker has also been appointed as a non-exec director of CQC for 3 years from the 1st of April 2026. No new declarations of interest have been made since ahead of the meeting. Is there anything from anybody around the table? No, thank you. And is there any urgent business to raise at the start of the meeting? No, thank you. We did have a private board meeting earlier this morning. These are for confidential matters. The board considered detailed updates on risk management, turnaround and rebuilding, business plan and strategy, revised delivery targets, and also focused on routine governance, financial and policy matters. A number of those are also coming to this public board and will come to future boards as well. In terms of the minutes for the meeting held on the 11th of March, are there any comments on those minutes? No? Are we happy to approve? Thank you. There were no actions from that for the board to review. So I'd like to hand over to Richard, who is going to do the report from the Regulatory Governance Committee on the 23rd of April. Richard, over to you.
Thank you, Chair. The papers include our what we call AAA report, which is advise, alert and assure, and I'm going to take the paper as read in terms of not going through every single detail on it. Many of the issues in the paper either are on the board later on today in specific alternative items, or will be coming to future boards. I do want to highlight two things, however. Firstly is in the alert section of the paper, we refer to our Specialist Professional Advisor Task Force. Now, Specialist Professional Advisors are a really important group of people supporting us in terms of our primary care inspections. They are not ubiquitous in terms of availability, and they are a key resource and working to make sure we've got the right number of people and that their roles meet our most important requirements for those roles has been a key issue for us. And our Inspector of Primary Care and Community Health Services has been leading a task force on that, and we had an update, and we will get further updates in due course, but we're hopeful that through that task force we will be able to resolve that bottleneck and challenge. The second issue I wanted to refer to was just one of the issues in the advice section of the report, and it's bullet point 3, and it's quality assurance and quality control processes across the inspectorates. As many people will be aware, the CQC is increasing the number of inspections that it undertakes from what was, we know, a low base a year or so ago. As we increase the numbers, and we are increasing the numbers more later in the performance section of the report, we need to make sure that we achieve the required quality alongside that increase in numbers. So we had a really good discussion. All of the chief inspectors assured us about the things they are doing to make sure that quality can be assured. And I wonder whether one of the chief inspectors might want to elaborate a bit on that for the purposes of the board.
Yeah, thank you, Richard. And I think I'd echo that. And I think one of the things that's been helpful in terms of that ability to have a renewed focus on quality assurance and controls, probably moving into the sector-specific teams in November, which has helped us, I think, really coalesce our management responsibilities with sector specialism and knowledge. And I think you need that knowledge and expertise to get your really quality QA and quality control processes. So we've done, I know in adult social care, and I know other chief inspectors have done similar, have sort of reviewed how that works on an ongoing basis. And what we've already seen is the ability for our leaders, managers and inspectors to be focused on one sector has helped sort of clarify the specific needs of an inspection report in a given sector, but also made sure that those that undertake those quality assurance processes are best placed to do that, i.e. have that sector expertise and have got that focus on the individual aspects of a sector, which, if we're honest, are the key components of a quality report. And I think that's just an example of why that move in November was really important. I mean, a lot of benefits are going into sector-specific teams, but I think that's one that's particularly stood out for me. Thanks, Richard.
So Richard, you mentioned the task force for the specialist professional advisors, and you mentioned those sitting in primary and community area. So I just want to check two things. So firstly is that it's about the SPA workforce across the piece. And I think the second thing is early on when I started as a non-executive, I had both some of the SPAs who I know in the mental health area, but also the network called me to a meeting and we're talking about long recruitment. They don't feel they're used the best, and they were really keen to sort of get in and support inspection. So I just wondered whether it's going to be sort of tackling all those areas and whether you got some assurance that we're getting to some of the root causes of those issues.
Thanks, Melanie. You have got the chair of the task force sat next to you. Maybe who want to elaborate.
Thanks, Mel. So yes, you're absolutely right that the SPAs work across all of our inspectorates, not only primary care and community services. And like you, when I arrived in July last year, I would say the biggest thing in my in-tray was the issues around SPAs. And in order to bring coherence and coordination to how we tackle it, I set up a task force supported by our Director of People, Jackie Jackson, and we co-chair that task force. We've been able to surface the common issues that people have raised around generally availability, being able to schedule when they can do inspection work with us, the recruitment process, onboarding and induction, and the data that underpins all of that, as well as workforce planning. So the task force has been doing quite a bit of work since November when it was set up. One of the key achievements is around significantly reducing the lead time in terms of recruitment. From a primary care and community services point of view, we've really streamlined the onboarding process as well, because that was one of the challenges that people had raised with us. And so lots of progress has been made, a lot of work yet to do. And I'm really pleased that now chief inspectors do have these forums. For example, I meet with all the SPAs in PCC every month. And I know that other chief inspector colleagues have their own mechanisms for that really robust engagement with them. So I'm reassured that the task force has taken forward the cross-inspectorate challenges, and going forward, each inspectorate will be able to take on the particular issues in their inspectorate, as you've just alluded to there.
Okay, thank you. Ollie wants to come in and then David.
Yeah, thank you, Chair. And just following on from what Bola said, it's been so helpful having that task force. It's really supported us in hospitals with our recruitment of specialist advisors. So that's very much led by our national professional advisors. And in fact, just this week, 2 of them have dedicated a lot of time to interviewing. And it's thanks, I think, to raising the profile of that, but also to our providers. A lot of providers have come forward, have advertised the roles within the organisations. Some of the Royal Colleges have helped us out with that. So I think having that specialist expertise will really raise the quality of our inspections, and it plays to our assessment framework that we're just coming up to the close of the consultation soon, where we've said we want more professional judgment from our inspection teams supported by those specialist advisors. So thank you for that.
Yes, Richard, on your 4th point and advise on new regulatory powers update that you gave us, just to let you know that given the importance that is being attached to neighbourhood health care and its delivery and the structures through which it will be done, the NIHR have appointed me to chair a 3-year programme to look at the assessment methodology that we use for the effectiveness of this relatively new development. So I look forward to liaising with you in some detail as that develops.
Yeah, thanks. Just go back to the SPA discussion, which I really welcomed at RGC. We also kind of discussed how we might widen the skill set of our SPAs, and I was advocating potentially we might want some SPAs that help us think about digital solutions in our providers, especially AI. And I mean, it's good time, so I really welcome CQC's statement on AI, which we published, looking at Aaron last week or the week before, I can't remember. So it'd be good, just at a later date, to think about how we widen that skill set to make sure we're getting the professional advice that keeps up with how health and social care providers are delivering services.
Sorry, we could end up talking about the whole organisation in this item. So, Bola, if you want to come back on that, and then we'll probably move on. That's all right.
Thank you, Chair, and Alex, thanks for that comment. One of the key things at the task force is the need for us to diversify the professional background of our SPAs and make sure that it's reflective of the multidisciplinary nature of how general practice, mental health, all our health sectors, dare I say adult social care, it is a multidisciplinary approach to doing the work. And so going forward, we will be reflecting that in the diversity of professional background that our SPAs come from as well.
Thank you, everyone. Thanks, Richard. I'm going to talk to the next item, which is the report from the Audit and Risk Committee meeting, because I am the substantive Audit and Risk Committee Chair. Given the interim arrangements, the Deputy Audit and Risk Chair is Mel Williams, so she's going to be stepping up to do more in that role during this interim period. But I didn't think I'd make her do this update, because I think she might not have been at that meeting. There are some items that are on the agenda that were discussed at this meeting: the annual report and accounts, which we've got later, and the board assurance framework. Where, in terms of the alerts, it's documented. We've been putting in a new governance framework. One of the things that we're very keen is that any unsatisfactory audits are clearly escalated through the governance route, so that is just being made sure that's absolutely in place. The other thing that the Audit and Risk Committee has put in place is, and we had presented this time, a framework explaining how CQC listens, responds and learns across all concern routes and how that is escalated and actions develop that. We have been receiving at Audit and Risk a report on that since I became chair. We are still evolving that, but it does look at those themes and it looks at process metrics as well, because that's such a key part of how we get assurance, but also understand where there are emerging risks as well. So I just wanted to highlight that. Happy to take any questions, but as I say, the substantive items are actually later in the agenda. Okay, that's David.
In terms of looking at risks, we obviously look at those things that could go wrong, possibly not go as planned, could delay, etc., etc. But I would make a plea that we also look at the risk register kind of from the reverse side for any opportunities that may occur as a consequence of those risks, something we might do differently, something that we might otherwise have missed. So it's really looking at the glass half full in a way, rather than just purely looking at the risks.
Thank you, David. Are there any other questions on this? Because otherwise that very neatly gets us into the board assurance framework, and I could get Chris to respond to that as part of that. Anything else for me? No? Okay. So Chris, board assurance framework and David's very pertinent comments.
Thanks, Kay. So, I mean, firstly, just to start with David's comment, I think that is a really good point. I mean, I'll say a bit about the BAF and then I'll come back to that, I guess. So, Board approved the Board Assurance Framework in March this year. This paper provides an update on progress. What we're aiming to do is demonstrate that we're strengthening our approach to governance and our approach to risk management. And what we've been trying to do is really stabilise our view on risk from where we've been. I think your lens of opportunity is a really good one, and probably something we need to focus on as we go forward. Just trying to emphasise, this is the first time we've had the Board Assurance Framework in a public board, so showing where we've got to in an open and honest assessment of where we are. It presents 12 principal risks, 8 of which are rated high, that we've been discussing off. Our focus now is on maturing assurance and working through action plans to bring those risks down. The BAF is now also is operational, and relevant principal risks are reviewed through our executive subcommittees, and we also have a risks subcommittee which reviews everything in the round. So hopefully we're starting to mature our approach to risk, and that was all I was going to update. The paper is to note, but happy to take any comments or questions.
So I just wanted to start off by saying that I really appreciated the transparency around this, and to see some of our risks. I think connecting the closing the loop between risks being identified and raised, and then seeing how they're being managed by the board and at a senior level is really important to our trade union members and just general colleagues. I did have a question around some of the tolerance levels around the internal cultural risk versus the external reputational risk. And I just wondered what was the rationale, if you're able to say it quickly, for putting that as a higher tolerance, as I think that our internal rebuilding work really underpins our public confidence and reputation rebuilding as well. So I just wondered if you could answer that. Thanks.
Yes. Susan's a good point. So we've set an appetite level that is probably not where we want to be as an organisation. I think it represents where we are right now, and some of the things that we'll need to tolerate beyond where we'd probably want to be. So it's trying to be realistic about where things are. So there's some things that might be in a moderate space that you wouldn't ordinarily see there. Hopefully that helps, Susan.
Okay. Sorry, it was Mel and then Esther, I think.
So Chris, it's really great to see this, and in ARUC, for some time now, this has been one of our, not surprisingly, big pieces of work, and it's taken a huge effort to get here. I think what we can see from it, so it's great, and as Sue says, the transparency is brilliant, but it also highlights that we're managing a lot of risk with quite a short timeline. So really curious about how we're, I suppose, implementing this and into the executive team. So that would be helpful to understand that.
Yeah, can touch on that, Mel. So I say we've got a risk subcommittee of our executive team that looks at all of the risks in the round. Every subcommittee of the exec team has responsibility for an element of this board assurance framework, so that's flowing through those structures. The action plans that sit underneath this are regularly reviewed and have been discussed with our wider leadership team. I think the thing we need to make sure and strengthen on, and when we come on to talk about turnaround later, is the BAF should really be the centre of everything and flowing through everything. What we don't want is separate action plans for different things that don't align with the board assurance framework. So this really gives us a grounding centre for everything we're trying to do. So what we need to do in that is also just make sure that what we're setting out to do is realistic and achievable, and we're not kind of overburdening ourselves with too many things to try and do in a space of time. That's the work that we're doing now through those subcommittees.
Thanks, Chair. Thanks, Chris. Just following on from Chris's points, Mel, I think for me what this does, it gives us an opportunity to reflect proportionately on the level of risk. It would be easier for us to perhaps individually reflect on risks in our own area, but this brings it all together. And I know as an executive team, we've really benefited from being able to discuss this at the forums that Chris has just mentioned, but also have some really good support and challenge with each other as to where our kind of priorities lie and whether we've got our kind of mitigating actions right. So both through the lens of kind of, does this feel right? Does this kind of feel like it represents the risk of what we're currently carrying as an organisation, as well as do our mitigating actions kind of feel right that obviously sit behind this. So for me, I'm used to a BAF. I think many of our provider organisations would be used to a board assurance framework as well. I think it's a really, really positive step for the CQC that we've adopted this as part of our new governance approach, and I know that we are continuing to strengthen our approach to this and our use of it. Just in response to Sue's question about appetite, Suze, it's a really helpful question because although we've got a single appetite score on here, it's much more nuanced than that. And so, to give an example, you know, the data score is a moderate kind of appetite. However, we wouldn't take that lens through things like information governance that we have kind of compliance, statutory compliance kind of regulations around. So, I think there is more nuance to that. So, but I think your question helpfully brings it out. So, thanks.
Thank you, everyone. If I might add, just as the ARAC chair again, I mean, I think what we've really welcomed is the improved clarity, and a huge amount of work has been done on this and making it reflect the reality of the organisation. There is still, for everyone around this table, a lot of disquiet with how many risks are outside of tolerance. So I don't think there's any underestimation of the work to be done. But I think, as you said, I think just to summarise the conversation, transparency has been welcomed. The tolerance levels are not where we want them to be. There are lots of risks with some short timelines, and we will keep working on keep bringing this back. I think as an action, if we could have an action that we report back on next time, which is David's point about the opportunity lens as well, to make sure that that's worked through, I think that will be really important. So thank you. Suze, yes.
Just a last question. I've looked at some of the data around this, and I think it would be helpful to understand if we, as a trade union side, identify some gaps in some of the controls under these, how would we engage with ensuring those are captured? I think there might be some hints at some things, I wouldn't want to go into detail here, but seeing some of what the current controls look like, as I can immediately see from the papers, there might be some things we're doing well in some parts of the organisation. Of that, let's share the good practice to help bring some of this back in line. Thanks.
Suze, that would be really good insight. I mean, I'll pick up with you separately how we can do that more formally. In the meantime, let me know.
Thank you. Thank you for that. That was the board assurance framework. Now over to Aaron for the chief exec report and the report from the exec team.
Thanks, Kay. And I noted you were talking about your role as the ARAC chair just a second ago. And can I just start by welcoming you to this new role, and just on behalf of all of us saying thank you for taking on this role and providing leadership to us as a unitary board. So I just wanted to say that at the outset. Colleagues, there's just a few things that I wanted to update on in this section. As colleagues across the organisation know and the leadership group know, we've been talking about the green shoots of recovery that we've seen in terms of the CQC's stabilisation and meeting some of the targets that we set out January of last year. So you'll recall there were 4 immediate priorities, and it's been really good to see month on month over the last few months progress being made towards those metrics. I just wanted to say thank you to colleagues around the table and within the teams for all the work that's taken place on that, whether that's in registrations, whether that's in the number of inspections we're doing, and we are exceeding the target where we should be for at the moment in time, and I'm confident that we will meet the target that we've set out, if not exceed it, and on information of concern and the various other aspects that we described as when we set out as metrics. So thanks for all the work that's gone into that, and we've talked about that in our all-colleague calls recently. I do need to kind of also mention that one of the things that we've been looking at through that process and as we've been recovering is looking at the significant variation that we do see within teams and between teams on our progress towards our targets. And I know that is something that we need to do more about to support colleagues and support teams so that we are achieving everything that we want for this organisation and for the important function that we have towards patients and people who use services. The next thing that I wanted to speak about is that we're now entering a phase of business planning. So those targets that I've just spoken about, they were up to September of this year. We're now at the stage where we are thinking about where we go from October and what we do next. And I think it's important that we've started to have those conversations about what ambitions, what numbers we're going to set, which represent the ambition that we have for this organisation. And I know I'm talking about numbers here, but every time we cross the threshold of a service that we visit, it's an opportunity for us to be able to see what's working well, what isn't working well, for services to demonstrate the improvement journey that they're on, and for us to discharge the function of ourselves as a regulator of keeping people and patients safe and promoting improvement within services. So it's really important for us to be setting ourselves targets that reflect our ambitions. At the same time, we've got to balance that need with the pace that we have for turnaround. And turnaround isn't just in this one area of productivity, turnaround is across the board at CQC. There's so much work that we need to do, building a better culture, making sure we've got the right regulatory tools, as well as the productivity piece that I've mentioned, and about our role in the health and care landscape. So we've got to balance all that work against the turnaround piece that we need to do. And we've also got to ensure that the quality of the work that we do is high. And I know we've already spoken a little bit about that, but that is going to be central to our recovery. Chair, they were the kind of key points that I was keen to just talk about as an organisation. I was going to just ask Bola, who is the exec sponsor for our work around the transition of HSIB into CQC within the health bill, to say a few words on that, because that's an important piece of work in our role in the external landscape. And Chris Badger, if he could say a little bit about a very consequential judgment at the Supreme Court just yesterday, which I think it would be helpful for us to be thinking about. Thank you.
Thank you, Aaron. So just in terms of the transfer of the Health Safety Investigation Branch to the CQC, just to confirm that we are committed to supporting the implementation of the government's policy around that. We have live conversations ongoing between the CQC, the Department of Health and Social Care, as well as HSIB itself. And we have established an internal working group here in the CQC supported by our non-executive directors, so we can work through the practicalities, the governance, the assurance considerations that we need to be focused on in implementing that policy. So, and as you've said, executive lead for that. I'm very much looking forward to working through that over the coming months.
Yeah, thanks, Aaron, for mentioning the Supreme Court judgment. As colleagues will know, that revolved around the Cheshire West ruling, particularly around deprivation of liberty safeguards. That's of relevance to providers across health and social care and individuals receiving care and support. Just to say, really, at this point, we're carefully considering the court's judgment, which was handed down yesterday, and its implications for our regulatory approach. Will be obviously liaising with other agencies within government and government departments about that, and we'll make sure we communicate our position on that as soon as we've come to that, and we'll make sure all our providers understand that and we're really clear about that. Thanks.
Aaron, I wonder if you could say a little bit more about why you see the variation across the parts.
Thanks, Ruth. A really important question. I think it is part of, we need to build up that understanding of why there's a variation between teams. I might hand over to Tolly to give a little bit of a sense of some of the work we've already done about that and some of the thinking. Thank you.
Oh, thank you, Aaron. Thanks, Ruth. Yeah, if I can put some detail behind that, if I may. So Aaron talked about our core purpose, for the public, for our sector, for patients and providers, in terms of inspecting in order to be able to support, improvements in care. So as Aaron said, it means getting across the threshold. And, we're aware ourselves, we've got some teams in our sector who get a vast amount of work done, really efficient, do great inspection activity that drives improvement. And we've got some teams that are not able to achieve as much activity, and we need to be able to support those teams because they want to. So how can we learn from the best practice that we're seeing in our own sector? You know, what are they doing differently? How can they help us across our sector? That's the beauty of coming together in a sector-specific way so that we can share that learning. So we're taking a sort of quality improvement approach to that, and also thinking about what personalised support we need to put in place so that people are able to get out. We know from providers that there are many organisations that have never been rated. There are many with so-called aged ratings where we've not been in for years. It's a frustration for them, and it's not helpful for patients who use the services. So we want to support them by doing what we do best, which is getting out, inspecting and rating with a view to improvement. Thank you.
Thank you. Are there any other questions about the Chief Exec report or Exec Director update? David?
Yeah, I was just going to ask, if I may address it to Tolly, who's following on from what you've said. Are we looking actively for, you know, information we could get, key ideas we could get from other people who are, for example, inspecting hospitals, not only in the four nations here, but overseas, where there are different processes, etc. Are we collecting some of that information? Have we a method of incorporating it in the developments that you've talked about? I think that'd be very helpful to know that, because we want to keep, you know, more than just up to date with inspection methodology.
Yeah, thank you, David. So a lot of work has been done in that regard. I think, for example, last year a piece of work was done looking at international regulation, and some of that work informed our approach to our draft assessment frameworks. So I agree with you, there's a lot of good practice out there to learn from. Our own chief exec was a regulator in Scotland, so it's an informal approach he brings us. We haven't asked him formally, but again, you know, within our own nation, you know, we have that opportunity to learn. So yes, absolutely, thank you.
Okay. Suze?
I just had a couple of questions around the report from the chair. I think the overseas working development is very interesting. I know there's a lot of trade union members who had previously requested this and thought the organisation had got a hardline stance on that. So I'm keen to see the detail of what is being decided here and the planned approach to maybe reach out to those who'd previously requested it, whether through line managers, as they are keenly waiting for an update around this, I think is what I'd probably share. And the second point was just around the support and performance improvement. Just to cite that we have been looking at 4 key policies for embedding the CQC way, and one of them is what was capability and has now been renamed in draft form at least. So support and performance improvement to take a different lens about supporting our colleagues rather than assuming that they are not delivering in their job. So I would just, I suppose, ask that is currently going through the policy route for sign-off. So I think it would be good to maybe fast-track or expedite that one to help with that particular aim. So thank you.
Thanks. My understanding is that Jackie Jackson, head of HR, is working on the communication around the overseas workers policy. On the second point, very happy to have a kind of conversation about that and how we, you know, factor that in. I was kind of, you know, very much about supporting colleagues. I know that, you know, when I'm out and about, colleagues want to absolutely deliver for patients and for people who use services, and we need to be able to support them to be able to do that. Thank you.
Anything else on that item? No. Could we move to organisational performance? So that here's some end of year pieces. I think Chris, you're leading that.
Yeah, I was going to just say a bit about our annual report and accounts, if I may. Okay. So we have just laid our 24-25 annual report and accounts. That has for the past few years been delayed due to assurance work around the external auditors required to undertake to gain assurance around pension asset valuation. So we've experienced these delays for a few years. That's not exclusive to CQC and is outside of our control. However, in addition, we've also been undertaking work on the valuation of our intangible assets to reverse a qualification that we had in 23-24. We've done that work and the qualification has been reversed, so that is good news. An unsatisfactory internal audit opinion within the report. So for 24-25 year, which is probably not unexpected, reflecting that is 24-25, it's worth saying significant work's been undertaken to stabilise our organisation, our leadership, our governance, our approach to risk management, as we've discussed before, which form the basis of the findings. Obviously, we'll continue to work on that and strengthen that and look forward hopefully bring forward the publication of future annual report and accounts ahead of the timeline we've experienced now.
We did have a extraordinary board meeting to improve the annual report and accounts, but it felt important that this came to the public board because it was laid a couple of weeks ago. But if there's no questions, shall we move on to the end of year 25-26 report? Is that all right with everyone? Yeah, thank you. Chris.
Thank you. So for 24-25, there is 25-26. There's probably quite a bit to pull out here. This is the first time we've presented a combined performance, people and finance pack. So I'll run through the key areas, but there is quite a bit to pull out. On performance, we've included a 2-page summary just so we've got a graphic of the performance across the year at a glance. We tend to do this at the end of the year just to help illustrate performance. In terms of assessments, we've achieved the target, or on track with the target of the 9,000 in the year. We delivered 6,382 assessments, which is still not the levels we want to be at for the future, and we've well documented that, but considering the prior year was 3,800, it is a marked improvement on that. Registration, we track the volume of registration applications over 10 weeks old. Overall volume has been reducing, but the 10-week old, over 20-week old has really come down, ending the year at 987. That's a 75% reduction from the 12 months point prior to that. And we've also processed 33,000 applications that are in completed stage. So focus moving forward is making sure we've cleared those over 10-week-old registration applications, but also get back into a business as usual measure of performance. Information of concern and other areas to just pull out. This is, just as a reminder, is feedback we received directly from staff, information about people's experience or information from partner organisations. We get about 200,000 of these a year. We did a lot of work early in 2025 to clear a backlog of cases, and what we've been trying to do since that point is get back to a more business as usual measure of performance. We've not quite hit the 95% target, but you can see Q4 performance has shown sustained improvement. Priority 1 referrals hit the target in March. Priority 1 taking action was just below, and priority 2 and priority 3 are now sustaining delivery above target. So that has stabilised, and that good performance is continuing, which is good to see. And amongst the other areas that I haven't pulled out, we've done really strong performance on our call lines and NCSC throughout the year, which performance has been really strong. And we've also delivered our assessments around our local authority assurance programme in year. Although delivery of publications does continue on, but the assessments were delivered. On our finances, we ended the year with a 5.6 million surplus. The main component part of this was a 3.5 million underspend relating to depreciation, given lower capital spend and related to our impairment work. There was also lower than anticipated spend in our digital and data space. That's not a recurring position. We're carrying financial challenges into 26-27. We've applied some saving targets into the organisation, and we expect that financial position to be challenging. On capital, we finished the year with a 3.9 million underspend, which we were expecting. And then finally, I'll just talk on our people side. So workforce vacancy rates at 10.5%, which is higher than target, but is slightly is intentional, given need to just manage our workforce composition and the controls that we've put in place around workforce. Recruitment and representation, we're seeing good transition rate for disabled and LGBT plus colleagues through application to offer stage. This is supported by an increase in overall and senior leadership representation, with a marked increase in disabled colleagues in senior leadership roles. With ethnic minority colleagues, however, we're seeing no issue in attraction, but an issue in conversion through to offer stage, and a really positive increase in workforce representation, but a drop in senior leadership, which makes the KPI target some distance at this present moment. A lot of work has been undertaken. Attraction isn't our issue. What we're looking at is more targeted campaigns. And then finally, on required learning, on mandatory learning, we've moved to a phased quarterly delivery of a mandatory training. We've hit above 90% completion the first half of the year. Second half was around 80% above the most training programs. So it's good progress, shows the phased approach is benefiting, but still work to do given this is mandatory training, and we should be aiming for a higher towards 100% completion. There was a lot to get through, so apologies for the length of that, but I'll pause there and happy to take any comments or questions.
Thank you, and it's a very comprehensive report. Any questions or comments? David?
Thanks, Chris, for going through that in some detail. I just wanted to pick up one point on your required learning, which was the figure for cyber security, the 81.3%. Cybersecurity is so crucial to us that it should be something that is as close to 100% as we can possibly get, because anything short of that is a potential major threat to the organisation. And I just wondered whether you had any specific initiatives on that to drive that figure up.
Yeah, thanks, David. And I would 100% support your view of the importance of training in cybersecurity. So a couple of things to note. We have our new Digital and Data Executive Committee, which is responsible for our cyber risk that we talked about in our board assurance framework item. And it's our responsibility as a committee to make sure that our colleagues are appropriately completing training. The board is new, the committee is new, and we are in the middle of working through how we may do this better, because I absolutely recognise we are not where we should be. Secondly, we are doing work as part of our rebuild programme on our training to support our colleagues to understand this area better. So we are monitoring it through that committee, but I understand and completely agree we need to do more, and that is the job of that committee to assure.
Esther, thank you for that. Just to follow up, if I may, it's a question about, in the work that you're doing, have you had real cut-through with our staff colleagues on the importance of cybersecurity? You know, is it something that they instinctively now feel is really vital to the well-being of the organisation, or you know, are we, as many organisations in the past have been, sort of, cybersecurity where, yeah, I know it's important, but it's not going to hit me very hard. Can you just give us a sense of that?
So my sense of that, David, I think most people will be aware of the risk. I think where we need to do more work is what that means to individual colleagues on the ground. And I think it's the operationalisation, can't say that today, it's that piece of the application of that, of understanding the risk into what that means for our colleagues on a day-to-day basis. It's the same with some of our other areas, like you know, records management and you know, data quality. Actually, actions of each and every one of us in our day-to-day working life have an impact on those risks. So there's more work to do to apply that knowledge, and I think in the cyber improvement plan that we have, alive and well, we have plans in place to support colleagues to better understand this, but that will be part of our improvement programme over the next year.
Thank you, Chris. Lots of numbers, and as Aaron said, I think lots of green shoots in there. I just wanted to dwell on the registration figures and actually just celebrate where we got to on that. And I'm not just saying that because I've been sat between the two execs that have been looking after registration, but when it was announced I was joining CQC, I was contacted by a number of organisations even before I'd started, especially I think in, you know, at the health tech world, to say they were stuck in the registration queue and what were we going to do about it, and it was clearly a big issue for people. And a number of which in the independent sector couldn't start generating income that they'd predicted until they got through that. So I think lots of successes in your data, but I think that's one where obviously it was one of our kind of core 5 where I think we've really have made some significant improvements. I know there's probably some more to do on that, but I thought it was worth just noting that I think that's something where probably I wouldn't be contacted in the same way this year.
Could I build on that actually? So you've just touched on the 24-25 annual report, which showed a no picture of where anybody wanted to be. Huge amount of work done in the last year, and I think you can really see some of those greens. Very, very hard won. So I'd like to say, as well as Alex's thing about registration, there's a huge amount of work gone into turning some of these greens. And I was just wondering, I don't know if this is you, Aaron, or anyone in the team really, with what's left, what are the stubborn reds? So, and what have you learnt from the things you've almost turned green that you could apply to those, or where things haven't turned green as fast as you thought? Just so we're sort of aware of, where the challenges lie over the current year. Is that you, Aaron? Chris?
Coming in first.
I think my learning from where things have turned green is that the wisdom on particularly very much frontline operational metrics, which are probably the ones that are most important to us anyway, the wisdoms from the people that are undertaking those processes of inspections every day, and actually the better we can be at listening and acting on what our colleagues tell us, the better we'll be in terms of turning the corner on some of the performance. I think applying some of that learning to the ones that are red, or not where we want to be, I think it's going to be a helpful lesson to take across.
Thank you, Chair. It's really just to echo that point that Chris has just made, that, for example, in terms of coming up with creative and innovative solutions, we've had some really good insights and intelligence from some of our senior specialists, for example, our inspector colleagues. An example of that sort of creative approach is the Return to Good and Outstanding project, and that was very much a frontline driven example of how we drive improvement. So couldn't emphasize that importance more. Thank you.
I'm going to remind everyone my question, which is, and where do you want to apply that to the stubborn reds? So I would like to know those as well. Esther, but I might come back to Aaron on that.
Thanks, Kate. I won't repeat Bola and Chris's points, but I think, particularly in registration, our colleagues have done so much kind of QI, quality improvement work on improving current processes. I think the stubborn reds are around where we still have manual processes in place, and I think that relates to a conversation around performance, how we are going to improve our processes. I know I'm being quite generalistic there, Kay, but I think there are many processes across the organisation that we know could still be significantly improved, and actually that relies on the colleagues who are actually undertaking those processes to help us and help us redesign them, and I think that's where we're going into in our next phase.
Any other? Do you want to, Aaron, just come back on that, or is it a different point? Okay, yeah.
Thanks, Kate. Helpful question. I mean, there's a few different buckets here. So there's some areas where I think stubborn reds reflect our resources and our recruitment. So, for example, in one of the mental health domains, we've got second opinion appointed doctors, vital safeguard for people who are getting treatment under detention. And we've been red for a while, and we do need to think about new ways of working there, and we've taken steps towards that within the mental health inspectorate. Chris Sakiti's not here today, and he's we mentioned his apologies earlier, but he'd speak to that. Second areas where we've got some stubborn reds is where we've had huge progress, but we've set really good targets, which is 95% of information of concerns should be turned around within that time frame, because we want those concerns to be dealt with really swiftly. Actually, we've kind of moved to 94.6% in some areas, or 93%. So we have made a huge amount of progress, but there's just that little bit further. But it is that second bucket of setting really high targets. The third bit is around that point that I made earlier, or the third bucket is around that significant variation. So if you look at some teams, they are showing red in some sectors. But when you go at the level beneath that, you can find that even within those sectors where there's a stubborn red, there are teams that have somehow managed, despite these challenges, to turn green and to actually achieve their team target, do the work for patients, for providers that that everyone wants to do. And I think we need to learn from those areas that have actually demonstrated that they've managed to get round this through different ways of working. And I think we need to take the learning from those teams and spread that across the organisation. Thank you.
Thanks, Aaron. Suze.
So mine were more general comments. I think I wanted to shout out to the heroic efforts of all of our colleagues, union members and non-union members, to get us through a lot of these greens, and the people who are sitting in areas that are still red. I know that they are working very hard to try and get us there, and those close margins are feeling like there's green in sight. That's Aaron. I had a couple of questions though around the mandatory training, as it does seem like the completion rates trailed off by the end of the year. So I wondered if there was a different approach being taken this year, as I think the staggered approach has worked, but I think there are still some, I would say, less than satisfactory figures around things like fraud prevention, safeguarding, as that 80-odd% is quite a chunk of our organisation that doesn't have that, and our fraud prevention team is very small. So I feel like we should be focusing on the prevention rather than the catching it and investigating potentially afterwards. And my second question, just to throw it in there, is around the recruitment data. I think it's great to see some improvements. We're hearing, the trade unions are hearing from members that recruitment is taking a long time to take impact in operations, and whilst people leave, that can leave a gap. So I just wondered whether you had considered reporting on recruitment timelines to try and get a better sense of whether some of the efficiencies around the SPA recruitment could be reflected in our general operations frontline, where we really need those staff the most. So thank you.
Does anyone want, Chris, do you want to respond to that?
Yeah, great question, Suze. On the first one, I think the phased approach feels better, feels like it's working, but I think the reason the first half is better than the second half of the year because they've stayed open. So you've got another half to complete the 1 and 2. So there's a bit of a misleading position, I guess, in a way, because we've just cut off the year for the second half, so those 80%. I think we need to get into a place where building on that approach, we really get colleagues into a place where the work's completed on the quarter. So I think it is just that more promotion and more making sure it's recognised as important as it is. On the recruitment time scales, I think can I take that one away? I think that's a good suggestion, but let me just take that away and see how feasible that is. But appreciate the question.
On the mandatory training, is there any evaluation of its effectiveness and its because we often get that it feels like a bit of a tick box exercise, do it now kind of thing?
I'll leave Chris to comment more widely, but certainly with the ones that are in my area, we review their effectiveness in. Oh, sorry, thank you. Did I say anything? No, so certainly for the ones in my area, we absolutely review their effectiveness along with our colleagues in the academy. I think, as I said earlier, there's work to do in some of the kind of digital cyberspace ones, but we do have a mechanism in place now to review their effectiveness. I'm not sure of history.
Thanks. It's a really important question, and it comes up not only here but in several organizations. I think my reflection would be that our patients, the public and service users, do look to these numbers to get a degree of assurance that actually we're focusing on the right things. So whether that is in terms of our anti-racism training, which you'll see it's one of our highest uptake areas, that matters a lot, to our stakeholders in terms of how much do we care about these things. And you're right to ask the question about the effectiveness, but actually the level of engagement with the training itself speaks volumes to people who use our services. And I think we shouldn't underestimate how much it means to people that we are doing the safeguarding training, we are doing the EDI training, we're doing the cybersecurity training and so on, because they look to us as the independent regulator to keep them safe. And this is just one way we demonstrate that we're doing those things well.
No, thank you, Chair. In fact, Julia, the issue you raise, NHS England are doing an awful lot of the work, a lot of work right now, looking at their provision of statutory and mandatory training. and moving towards an outcomes and effectiveness-based approach rather than purely compliance with undertaking the activity. And that's an approach that we've supported. Both Julian and Aaron have confirmed support for that. So although we have no firm plan to do the same ourselves, I think we support the principle of it, don't we? So yeah, good point you raised. Thank you.
Any other, Tolly, any other comments or questions? No? So thank you for that. I mean, it really, I think Suze has said it and it's come up at various times. There's been a huge amount of work that's gone on. Really great to hear how much everybody is leaning on colleagues' expertise and really pushing through that sort of continuous improvement. Still ways to go, but fantastic green shoots. It does feel the training's just come up a few times. It might be helpful to consider whether something, a little bit of a review on that could go. I don't know if it's the People and Culture Committee or somewhere, but I think it would be helpful to report that through to board so we sort of know what the direction is on that. But thank you very much. If there's nothing else on that item, we have our networks update. I think we're going to start with Suze, if that's all right.
That's absolutely fine. I don't think we discussed who was going first on this one. No, it's all right.
No, fine. Watch and learn.
Oh, so as usual, you have the three key updates for the board, or key headlines from members from your joint trade union side. So the first one was, I've already mentioned the positive work we're doing around the policies and embedding the CQC way and trying to unpick some of the inequalities that have been highlighted in previous reports. But the trade unions jointly have ongoing concerns about some of the equality data we're seeing around some of our formal processes and whether we're meeting our public sector duties. We've been working with the deputy directors in the People Directorate to do with it, to look at this and unpick it a little bit further. But I think there's a lot of work to do in this area to ensure that we're creating a fair and equitable working environment for our colleagues. Some of this is reflected in the equality impact assessments work, which is under review. Barry Hutchinson from the Royal College of Nursing delivered some really fantastic equality impact assessment training to try and bring in best practice. I know there's a QI project going on to look at what our base level is for equality impact assessments, or EIAs. It's great to hear some of the fantastic work that Bola has been doing around health inequalities and seeing that start to be reflected inwardly. That was that. The second point is around, and I feel this is a delicate one to raise in this room, if I'm honest, the engagement from the board. So we'd like to invite board colleagues to consider how you engage with CQC colleagues and how that could be strengthened. I think there's a disconnect between the engagement at senior level when concerns are raised and followed up. I think that's reflected in our staff survey, and how do we close that loop. And I think there's some really valuable discussions here, but these interactions are limited. And under our previous board and executive leaders, concerns are raised about over-reliance on management updates and a bit of a lack of curiosity around what that felt like for the general employee, the people doing the work. It was identified as a contributing factor to the issues experienced during the transformation programme. And so it's a little bit disappointing to feel for members to report that they're still feeling that the speaking up doesn't always get responded to, or they don't feel that their words reach the highest level where there is that influence. So meaningful engagement is not just about hearing concerns, but it's about visible follow-up and accountability. So it's especially important when we're trying to recover and to get all of those metrics into green, and in the gap of our freedom to speak up recommendations being fully embedded. So the trade unions would like to invite the board to reflect on how well you engage directly with colleagues and staff representatives, how the employee voice is balanced alongside other management assurances, how concerns at board level are followed up, tracked and communicated, which I know is part of the freedom to speak up recommendations, but haven't had that discussed at September. We've been delayed in implementing some of that. And what further actions are needed to demonstrate learning from past failures and commitment to the freedom to speak up recommendations. And then I think the third one, so I realise this is a lot to go in one go. The third one is around workloads, and a staff survey echoes this as well, but our members still report that there are areas where a lot of people feel they have an unmanageable workload. Operations staff are really keen to see what our workforce model, our resource model, whatever we're calling it, looks like, and just how that can be looked at a macro and a micro level. as I think looking at the best practice in teams, how we share, how people are doing things efficiently, and how we balance out the different pressures in different teams. The unions recently ran a survey with our members that picked up this thread exactly, so we'll be sharing that with senior leaders to sort of strengthen that conversation going forward. That's it. Thank you.
Thank you. Can I suggest, just who wants to take the equalities point? Bola, if you take that, I'm just going to say on the concerns piece, I'll answer that. I might ask Ruth to come in as our Freedom to Speak Up guardian as well. And who wants to take workload? Chris, right. We have. Thank you, Suze. Thank you so much. Bola.
Thank you so much, Suze, and thank you for the very kind comments about the work on the health inequalities. I just want to say here that Laura Saunders, who is one of our deputy directors, has been doing a phenomenal job, as you can see, working across the CQC, but actually beyond, to provide a clear articulation of the role of the CQC as a regulator in using its powers and processes to essentially be the powerful voice on behalf of the powerless, if you like. So really good to hear that. I think the broader point in terms of equalities around colleagues' experiences, as you know, the executive team recently supported the anti-racism piece of research, which was a whole organization action research process. And what we've said is that the learning and the recommendations that have come through that are hardwired into our core work, because what would be a missed opportunity would be for us to see that as a separate and standalone action plan, when actually we have the opportunity to thread all of that into some of the data that is coming through this report. And I think that's the way we make meaningful progress in what really matters to people. So just wanted to flag that that's a really important piece of work. And we need to hardwire it into how we do business as usual. But thank you.
And Susie, should we just go around, and then if you want to come back at the end, then, or do you want to come back on each individual?
Oh, that's fine. I'm happy to.
Okay, thank you. Just on how colleagues feel, and I think it's, we need to say how people feel is really, really important. And if there's that perception, then we need to tackle that. So I was just thinking about, I know I and other board members were lurking. I lurked on a couple of all colleague calls and leadership team calls last week, because I am curious, and I know other colleagues and non-exec directors around the table are really curious about what colleagues are saying, and in some ways we want to be lurking and listening, but that doesn't mean that that's visible, and it doesn't mean people feel that. So that's a really important point, and let us take that away and reflect on how we can make that more visible to people. In terms of the general concerns I outlined in the ARAC chair piece about that, that's something I feel very, very passionately about, and Chris Usher will say I've been a bit of a dog with a bone about it, about making sure we close that loop, and that is why it is a standing item on ARAC. The reporting, it's taking time, this stuff takes a while to go through, but it's absolutely on there in terms of formal governance. And we'll take your comments away again. It's making sure that people feel it as well as it's there. And also maybe there are gaps. So that's just from that point of view, and maybe it's worth a conversation outside to sort of hear other ideas. But Ruth, do you want to? Ruth is our Freedom to Speak Up board. I don't know your official title, but I know you are very committed and take a lot of time on it. So
I do indeed. I am the Freedom to Speak Up, and I've taken it very seriously. And as Aaron and the team know, I give everybody a good proportion of my time. I feed back to the team the themes without breaking any confidentiality, because I think it's important that people can trust me. I like to see action from that. I think it's important. I think that any work we do around culture, hopefully that will start to even bring out, even more of a transparent culture. That's what we want to get to. So I enjoy it very much. Some of the conversations have been difficult. I won't dress that up. They've not been easy, but hopefully they feel that they've been listened to, and I certainly know from the exec they take action on those themes appropriately. Yes,
and those themes and actions we're now trying to get the tracking through ARAC in a more systematic way, but it's taking time. So, and I again like to thank Ruth. She does put a huge amount of time into this, I know. On workload, Chris.
Yeah, thanks, Suze. I mean, we can look to share relevant insights with colleagues. The first thing I would say, we have had some support just to look at current delivery and some of the headwinds, as we call them, some of the challenges that colleagues face, in which probably tallies with the things that colleagues are saying in terms of just the things that get in the way, whether it's SPA cancellations or whether it's the level of new colleagues and the time it takes to onboard and various other things. So we're just reviewing that modelling to understand capacity and prioritise realistic workloads ahead of what we do next in terms of our business plan, our turnaround. So that's probably where we'll get into more of this. So what do we do with all this? But we can share insights with you. Yeah.
Yeah, thanks, Suze. Just following on from Chris, I think there is also something really important about working smarter, not harder. And I say that in recognition and the knowledge that many of our tools that we use, our regulatory platform and other systems and processes are manual and need improvement. And I think that colleagues will start to feel an improvement in this as we roll out additional capability and also expand our use of artificial intelligence to help us automate and do things smarter. So I wouldn't want to, it would be remiss of me not to say that I absolutely recognise the feeling from staff that they are under pressure. I think there are tools and plans in place that will support that as well.
Thank you. Julia. And then Alex.
Yeah, flexibility, I mean, it's a pressure, but it's one that we need to harness more. And we see this in sort of teams where there's very flexible working processes or arrangements, which is a great, supports lots of colleagues in being able to do what they do. But we also need to reflect and recognise the pressures on the managers of those teams. We do have very inconsistent practices. We've never really got to the bottom of why that happens. But, if I imagine the manager that's got 8 full-time people and another manager that's got 12 people with a whole mixture of working patterns, there's a big pressure there for the manager to give a lot more people time. And this could also go back to the comment about performance of teams and the variation. So I don't know if there's any analysis against, how teams are comprised in terms of how they deliver.
That's a really good point. Chris, is that...
I mean, just very, but that was exactly one of the headwinds that came out. The variation and the issue around spans of control was one of the problems and the challenges. So I just agree, Julia.
And just then how we support those managers with that, because it's not just the people that need the support, the managers need it too. So, and how we get those massive variations, particularly in the carers network, where somebody's got a certain arrangement, but that doesn't apply for anybody else, and all the conflict that then creates. So, yeah.
Julie, we're starting to stray into your area, but Alex had one more point.
Sorry.
And does anyone else have any more points? And then we're no, don't apologise, but Alex.
Thank you, Sue, for that report. And just on the point about how the board can engage more with colleagues, and just to echo Kay, I think it's something we should tell you what we have been doing, because I'm not sure that's visible, but I think certainly we should talk about it and be able to respond to that. Like Kay, I do tend to lurk on those Wednesday leadership calls, and I'm very grateful I'm invited to those, and I attended part of the all-staff call, and I've been quite privileged to meet quite a number of staff in data and digital. But I suppose just to say I'm very happy to do that. It's cognizant of our role and how we do that, but I'm happy to put in the time to do that. I think it's a really valid point. No need to apologise for raising that at all, but I agree with Kay. Perhaps with Kay and Aaron we could come up with a plan for that in one of our offline meetings and come back. But I think perhaps we're not always visible, but often we're there.
And if I just echo that, I mean, one of the most it was so important connecting me with why we're here is I went along with colleagues on an inspection, and they were absolutely fantastic. But to be able to see that firsthand is absolutely extraordinary. Not visible, and that's the point. We've got to make sure that colleagues feel that. And I took a huge amount away from that. So all of these things are really important. But as Alex said, well, let's take it away. Suze, do you want to finish up, and then I'm going to hand to Julia.
If you don't mind, it was just a little thing of I realised that I felt uncomfortable because I feel like the feeling heard by your board and the more senior levels of your organisation is that closing the loop theme that's come out in many different areas. But I did want to acknowledge that some of the governance and improved risk reporting and the transparency, I can see again that's the green shoots of that work, and I'm hoping that that will lead to people feeling that there's that more two-way dialogue up and down the organisation. And the only other thing that I forgot to mention around workload was an emerging issue that operations colleagues feel that there is a over-reliance on reporting on a lead inspector on assessments, and that we're not maybe at this level looking at the really valuable support that our colleagues do for as secondary inspectors on assessments, and just to make sure that we are really capturing all of the contributions, because a lot of the areas where they're green, there's a lot of people who have helped the one person that we're tracking to get us across the line for that specific provider, that report, whatever it is. So yeah, I just want to really voice that very live issue that came up on our members' call this week. Thank you.
Thank you, and a really rich discussion. So don't apologise, and your the work you do, and also to distill everything down to 3 is no mean feat. So thank you for that. Julia, welcome. Oh, sorry, Tolly. I said, is there anyone else? Tolly, you're killing my chairing here. Go on.
Sorry, just in context, if I might frame it.
Yeah. Oh, right, you're moving on. Oh, brilliant. Please.
Yeah, thank you very much. Yeah, so it's just to say it's my privilege to be the exec sponsor for the Carers Equality Network. So obviously, in my biased way, delighted that Julia is here today to talk about our network. And just wanted to frame it very much because next week is UK Carers Week, 8th to the 14th of June. And Carers Week is an annual campaign to raise awareness of and celebrate the caring that goes on. So it's to highlight the challenges that unpaid carers face and recognise the contribution that they make to families and communities and to our culture in this country. We want to be a country where caring is valued. And I think we recognise how hard unpaid caring is, but also how rewarding and joyful it can be for people to feel they've cared for their loved ones. And the network plays such an important role in helping us as the employer be better at doing that. So over to you, Julie, if I may. Thank you.
Thank you, Tolly. Just a quick overview of the Carers Network. We have about 300 plus members. Our membership is quite fluid because caring can stop, start, finish, change shape completely. So people do join the group probably when they more have acute needs, and hopefully most of them will stay. And members often belong to more than one diversity group. We've found that where they're caring for relatives that have a particular condition, that carer, that working carer, may also have that condition. So there's sort of multi-complex challenges. The network's inclusive, participative, and one of the great strengths of it is people sharing their experience of navigating care systems, particularly around support for children with educational needs and things. I've not been in that place, but I've certainly learned a lot from that. Progressed, I would say, in the last couple of years with a lot more recognition of carers at CQC, and also, more openness to the flexibilities of how people might work with their caring roles and responsibilities. The appointment of Tolly as the senior sponsor is great. We need to do more work on that. We'll come back to senior sponsorship. And as I said, strong peer support. We engage not only as chairs, but also with our members in any policy revisions and updates. In terms of improvements, I think I've probably covered the thing about line managers with the very varied sort of teams and the team's need. I'm just whipping down now. One thing I would like to see is an area to improve is supporting after a caring role ends. Often, I'm not saying it's any different to any other kind of bereavement, but often the role ends with a bereavement, and the impact can have sort of many different aspects, sort of practical, guilt. I've even had people feel that they've lost their purpose, a financial impact where whatever was coming into the house was probably supporting, the very poorly person, and somebody actually had to move home on top of everything else. And sort of some support systems for people transitioning from being a carer to not being a carer as such. And one example of that was somebody, it took 4.5 months to remove medical equipment from their house. So they lived with seeing that every day and went through a whole mix of emotions that actually caused that person, sort of other issues. And then building on from that, obviously with Sue's comments about the senior engagement, over the last 2 days, and I only just came back to work last week after an illness myself, network colleagues have almost overwhelmed with the issues that they wanted to raise. and it just felt like a 5-minute slot at a board 2 or 3 months apart isn't really sufficient to do that. I don't feel that's fair to, you know, our workforce and our needs as diversity groups. And sometimes it can feel like we're, you know, sort of like kicking the box to test it, and we're not and refining its shape. But what we need to do is rip the lid off and get down into the content and really work through some of the key specifics that will support our people better, and how we work with those. Working with the board and exec sponsors more to ensure our approach, both as a regulator and employer, leaves no one behind, and I think that's quite crucial and critical. And from that, I believe there's a strong case for a structured engagement workshop type session with co-chairs and exec sponsors, where we look at some of the issues across the groups and look at some of the issues specific to the groups, and have a very clear joined up approach and a plan how we will use our time, our expertise and that to really drive these 5 or 6 networks forward. That's me.
Thank you very much. I've just seen Esther wants to come in.
Mm-hmm. Yeah, Julia, thank you for that reflection. And I guess what I'm just following on from the question around board engagement, what I'm reflecting on is that we all are exec sponsors for a network. And yet I'm interested because actually our updates around those staff networks and our exec role haven't come through in our papers at board. And I think there is something about that. I think there is absolutely, each of us are very dedicated to supporting the networks because they are so important and our members within them are so important. But I'm reflecting on my own part in what you've just said, so thank you. I think my thanks to you and to all of the other chairs and colleagues who work hard in the networks often go above and beyond the work or the hours you are given to dedicate to doing this, so thank you so much. And also I wanted to remind colleagues it is Pride Month. My LGBTQIA staff network colleagues will not forgive me if I don't mention that, so please do take a moment to recognise how far that community has come in the last few years and discrimination that community still faces. But obviously all our colleagues and staff networks are very valued and we want to support you.
Just to add to that, we're still awaiting the diversity data from the last staff survey. Previous surveys, some of the outcomes have actually shown, you know, the sort of impact on people with diverse conditions, and particularly, I'd say, disability, where people have fed back through the surveys that they've felt discrimination. So.
Thank you, Julia. And we've actually got that coming up in a future item, next but one item. So, Chris, you might want to just touch on that then. I think yes, it is Chris. Thank you very much. I think you've given us things to think about. I mean, you make a really good point, Esther. You wear multiple hats. Are all of those hats coming through on our reporting? I think what you're giving is a bit of a wake-up call about, you know, how explicit. There's a lot, as you said, there's some green shoots. There's a lot going on. How explicit and visible is it? But also that closing the loop. So, you know, we will go away and really think about that going forward. So thank you so much, and everyone else. Sue, sorry.
It's all right. I just thought I would echo that. I think a suggestion of a different forum to hear the employee voice in a more informal capacity. As much as we're very appreciative to be here, we are aware that it is a public forum, and I know that I am very diplomatic with the way I say things because I care about the reputation of our organisation, and I would never want to. Yeah, I would want. There's definitely topics to discuss. The way just having a less rigid or formal conversation would be beneficial to maybe move some things forward a bit quicker. I think we often get sort of a little bit tied up in bureaucracy. So yeah, just to echo Julia's point. Thanks.
Thank you. Thanks very much. If there's nothing else, we started with our employee voice, and we're now going to move on to provider and stakeholder insight.
Thanks, Kay. So just a few updates from me on what we're hearing from our stakeholders. I'm very grateful to engagement colleagues for compiling all this information. There's just a few key points that I want to make sure that we're thinking about and is informing the decision making that takes place in the organisation. Our stakeholders are really supportive of the direction that we've set out for the CQC and the recovery plans that are in train. What they're saying very clearly, though, is that in order to maintain that confidence and that window that we have to keep on delivering and showing delivery across the key areas. They've been really encouraged to see the progress that we've made on the assessment frameworks and the draft assessment frameworks being published, the roadshows that have taken place, real strong support for that activity, and grateful for operational and policy colleagues for all the work that has, and engagement colleagues for all the work that's gone on in that area. What we're hearing very clearly now, though, is a need for us to build on that, to increase the volume and the quality of the inspections. Very much kind of what we're thinking is very much what is being reflected back to us. They're also asking us to prioritise the right services to look at, and they're saying it's really important that as well as the volume, you're thinking about which services you look at. I know we've recently published our priorities for each sector. They're kind of really thinking about where do people experience the most risk, where do patients experience the most risk, what services have we not been to in a long time. So those sort of conversations are coming through very strongly, and that's very much in keeping with the sort of 10-year plan vision for the regulator and where we ought to be getting to. I wanted to just finally make a comment on the external strategic advisory group. Some brilliant conversations have been taking place there. That's a forum that brings together many of our key stakeholders. We talked a little bit about the work that we're doing around turnaround in the organisation, and we talked not just about performance but also about the culture. And there's a real strong support for that. The culture of the regulator matters to the culture of the health and care landscape. Really important to think about that, as well as the regulatory tools in people's pockets, and as well as making sure that the CQC is playing its role on the external landscape. What they're saying very clearly is that they would like to see an emphasis on quality and clarity of the reports that we provide, both for public, patients, people who use services. That's really important. And they're saying that it's important for us to balance the pace of the turnaround with the need for the quality and consistency of our reports. And again, they ended on talking about the assessment frameworks. They have landed well, and thanks to all the colleagues who've been involved in that work. There was a clear ask around the assessment frameworks about how we are making sure that we are prioritising an emphasis on outcomes. What outcomes do people who use services experience and patients experience, and how do we kind of ensure that our assessment frameworks are kind of looking at outcomes? I was going to bring Chris Badger in to speak to a little bit of the detail on outcomes before I open that up for any questions. Thank you.
Yeah, thanks, Alan. I know a lot of us have been out and about as part of the assessment framework consultation. I know I've personally been in discussions with actually thousands of different providers on it. One of the themes that I think we and providers and people that use services have come together on is the idea of trying to make our assessment framework more consolidated, simpler, clearer, and I think doing that around the idea that people's experience of care is what we're really here to be about and focus on. So how effective care and support is, but also how they experience it, given what a big part of people's lives it actually is. And I think making sure we deliver a set of assessment frameworks that are, in a sense, rationalised to allow us and our teams doing assessments and inspections to have a real focus on that, and build in enough time for them to really hear and listen to people that receive care and support and those that care for them is really important. And that goes all the way through from all sectors to work we do with local authorities to care homes, to home care agencies, to big hospitals. Those principles remain the same, and I think it's important that we've seen the strong consensus behind doing that, and that as we finish the consultation on the assessment framework and listen to what we've heard, we reflect on that and make sure that's really visible in our final set of frameworks when we agree them. So I think I'd really echo that sentiment, and I've been struck by the strength of opinion that we've come across the country on that.
Thanks, Chair. Just to say that I joined Aaron in the last strategic advisory group meeting with all the external stakeholders. It was my first meeting as a new NED, and this is dangerous, just repeating everything Aaron said, because all those things are true. But I just felt personally that, firstly, how supportive our stakeholders are of us as an organisation and what it is we do, and how important that is. And in that sense, as Aaron has said, very supportive of us in getting this right. But I also equally, I'm just repeating what Aaron said, really sense that, but if we don't get it right, they'll be telling us. So I think there is that window, as Aaron actually clearly said. I think it's interesting, slightly different views from whether you come from a provider perspective or from a patient user or service user perspective. Some of the providers were saying they really welcome the new methodologies, new assessment frameworks, but they want to get it done now. Can we just finish it so they know what good looks like, and they can get on with making, supporting their organisations to provide the highest quality possible. Some providers was talking about. Aaron mentioned inconsistency with science proportionality of how many inspectors were turning up vis-a-vis the size of their organisation, and maybe there's something we can look at there. Given we've got a challenge of capacity anyway, we should make sure that we're spreading our resources equally across our registrants, if I can call them that. And just finally, from the more patient and user groups, raising inequalities as an important issue when we know there are inequalities in outcomes based on various demographic criteria, and are we doing enough to build that into our inspections, and builds on Chris's point about outcomes. So it was just kind of three of the things that I picked up from that discussion, but I thought it was a really good meeting.
Thank you, Chair. I wanted to start by thank you for this 6-page report, Aaron. I thought it was very good, very concise, to the point, and that's not always easy to do. I have the advantage of getting out around our network a lot because of my Health Watch role. So I meet a lot of ICBs, local authorities, provider collaborations, etc. And so I get direct feedback from them. And I just wanted perhaps to add 3 particular points to those bullet points that you've put in here that I've observed. Perhaps 3.5 points, because you've mentioned variation. But in fact, I think variation goes across just about everything that we're doing at the moment. The form of it, the content of it, the length of the report, etc. Now, I'm not asking, in a sense, for all the reports to be formulaic, because that would be completely pointless. But I think there's some tightening up that needs to be done there, a sense of what is working well and what is perhaps not working less well. My second point is that what I have noticed, and what people have said to me for a long time, is that there is a lack of triangulation of evidence in the inspection teams. In other words, there'll be a comment on there that is picked up, but when it's been questioned, it's not clear who that's come from. It's not clear whether that's been triangulated. It might be a staff member who's made a comment. Was that checked out in any way with a patient, with a carer, etc., etc.? Now, I know I sound like I'm speaking from my role in NICE, but this triangulation of evidence goes right to the heart of our authenticity, and I think there's work to be done there. My third point is really that we have 153 local health watchers who are really engaged at neighbourhood level. And yet I think it's fair to say that they are not frequently really consulted about what they know about what is going on in that care home, that hospital, that GP practice, that community health provider, etc., to the degree that they have. It comes back to me in the sense of when they see a report, they say, well, why didn't the CQC team ask us about that? Because we've just done a report on that and there's no mention of it. So there's something to be done there. And I suppose I would sum it up by just reminding us that although we are definitely not an improvement agency, part of our mission is to be an agent for improvement. And I just think there's more work to be done, Aaron, on meeting that latter point.
Just before you come in, can I just build on David's last point, which was, it was around Health Watch and getting that insight and how that's there. But the one things that struck me about the report, we talk a lot about pace and transparency and feedback loops, but there was a lot in there about integration of intelligence. And I think that speaks to David's point about that wider intelligence. So it'd be really helpful to know where we are on that and whether that is as visible as some of the other elements.
Should bring Esther in.
Esther and then Bola.
Thanks, Kate. Thanks, David. And your phrase at the end about us being an agent for improvement was going to be my starting point, because I too, Kate, picked out the points in here around integrated intelligence. I think it's very clear from what we know that our stakeholders and partners have an expectation on us to do that, and I think it's clear that we are also not there yet. We have had a conversation at board a few months ago about how we might want to step into this space. Kay, I think part of this is about our turnaround and building our fundamentals to enable us to do this. I think there is a future board conversation about how we do this well alongside our partners. Early conversations are in progress with our partner organisations, but I do think we need to have that conversation as a board, because I 100% agree that we have more work to do, and this is where we need to get to.
Thank you, Chair. I just wanted to speak to the observations that Aaron has picked up there. They very much echo what I've heard, and just to say, we are responding. So for example, one of our directors in the Primary Care and Community Services Inspectorate is tasked with leading our work to streamline our systems and processes and ensure that they're fit for purpose to drive up the volume, the quality and the consistency of our reports. I'm hearing from a sector-specific point of view around the clarity of what good looks like, clarity of the evidence that we're looking for, that our processes are streamlined and consistent, timeliness of our inspections and re-inspections, and a really big plea to remember that the assessment frameworks are tools, and how important it is that we train and support our inspector colleagues, particularly as we rely more on professional judgment, so that that is both objective and consistent. So just to say that we are on with that work, and it triangulates in terms of what we're hearing.
Thank you for that really useful conversation. I think maybe as an action, we should just put on the board forward plan about the integrated intelligence, including how Health Watch and other sources, broader sources of insight are being used. I think that would be great. But really, thank you for bringing that item, because I don't think we've had that as routine. I think it's really important. We are a little bit behind time. We're going to go into the people and culture update. I'll hand to Chris in a minute, but just as a framing, this did have a long conversation at a board seminar. The results, and some of the results have been socialised with, the results, not some of the results, but this has been socialised with colleagues across the organisation. But it's really, really important that we also have this at our public board meeting. So I just want to say this is not the first time, but this, it's a really important item. So over to Chris.
Thanks, Chair. Yeah, just a few bits to pull out, if I can. So, generally, we can see signs of recovery from a low point in 2024. However, it's clear there is a lot more to do. I've looked through all of the survey, all of the comments, and all of the detail. There is disparity across the organisation. There are some areas that are showing really strong. I've seen teams with really strong scores, really strong. I've also seen the opposite of that, and it's way beyond what we'd want those areas of business to be and to score. So it's worth putting that out there. There is some real contrasting positions across the organisation. Looking at the analysis and just drawing this out in the way it's been framed. So in terms of our purpose, 73% of colleagues feel that their work improves care. So there's a strengthening between colleagues' role and our purpose. And on our clarity, this has improved locally and within teams. However, organisational clarity is not yet strong or consistent. I think the work we've been doing around the 4 strategic pillars and our turnaround will hopefully help support this in the direction of travel we're in, but obviously this is just early days around that. In terms of leadership and teamwork, line management and teamwork is really strong. It usually is within CQC, but we shouldn't underestimate that. Views on executive alignment with values has improved, but we have much more to do. And there's a key bit in this space, which is around the leadership strategy that we want to bring in and strengthen our leadership approach. Improvement and voice colleagues are willing to contribute, but there is a low confidence that action will be taken, which plays to some of the conversation we're having earlier. There's a strong sentiment of avoid and follow through or even closure, and that comes out in the comments as well. So that's not always about agreeing, but that is about closing the loop and the rationale for not agreeing or for not taking something forward. I think that lack of closure sometimes erodes trust, so it has to be an area of focus. On consistency, around 55% of colleagues have clear objectives in a recent performance review. The timing of the survey may have impacted this just in the period it was ran. We've done a lot of work around objectives and hopefully we should have a clearer view on that. But they are, as you'd obviously expect me to say, but vital because it helps assess how we're managing performance, how we can develop and what's expected of us. And finally, in terms of inclusion, respect and inclusion is improving. It's 75% positive, but I think the concerns remain about fairness and equity. So it shows a culture may be improving, but structural issues remain. They were all the bits I was going to pull out, Chair, and happy to take anything on the survey.
So I'm mindful that we have an item at ARAC coming up to have a look at assurance on the CQC way. Is there anything, Chris, that we might miss? So, because you've talked about all of the conversations we've had, and we've looked at this extensively as a board in different forums. So with the ARAC look at the assurance of the CQC way, are there any sort of actions here that we might have missed from any of those work streams that we would need to pay attention to?
I'd hope not, Mel. I think there should be aligned. The work we're doing, the work we present through, and then the follow-on conversation we can have in board in July, it should align with what we're seeing here. Some of these areas will be harder and knottier to address, but the work we're doing with that CQC way should address them.
Yeah, I just wanted to make a kind of, to align this conversation with the question you asked us earlier, Kay, around where we see green shoots and how might we apply them to red shoots. And we talked about, red shoots, that's not the right word, but you know what I mean. We talked about the need to engage colleagues in helping solve the problems or overcome the challenges effectively. And I think this is a really important lens to look at our people survey results in, because we all know that culture is not just one thing. There are numerous microcosms of culture across the organisation. In teams, we see that from the results of our kind of incidents and kind of concerns that are raised. We see that from feedback from our colleagues in the staff networks. So there is an inconsistency in how it feels to work for the CQC, depending which team you're in. And so for me, this is really important because we had, at our recent leadership group event, we had a discussion about how we might better involve our teams in what the solutions to some of our challenges from a culture perspective would be, and Bola really helpfully talked about that from an appreciative inquiry lens. So I just wanted to make that link because I think us having an idea around culture is one thing, but to your point, Suze, unless we really know how things are on the ground, it's very difficult. We need to seek that input from colleagues.
On your point 5, I just wanted to comment. If people aren't properly and fully involved in the discussion about their objectives and agreeing their objectives, if that isn't the case, and Chris, you've pointed out what the figures are, 55% at the moment, then two things, in a way the less important of which is that we can't really hold them accountable because we haven't got clear objectives to hold them accountable against. But that isn't the main point. The main point is that how can we know how we can help them? Because if we don't know what their objectives are because they haven't been set, or the recipient is not clear about what those objectives are, it's very difficult for executives to find a way of intervening in a situation to help those people achieve those objectives. Are we going to do anything about it?
We're going to be tracking how colleagues within the organisation have objectives and make sure that people do have that. Without that, I totally agree with your point, David. If people haven't had clarity around objectives, then it's very difficult to kind of see how we support them best.
just a little note of caution around the great tracking objectives and that engagement at that local level, which is really vital to people doing their best at work, is happening. But a little word of caution to not just trust the stats around that as if we're just looking at a system. I did have, unfortunately, some reports from members back end of last year that they hadn't had one-to-ones, their teams were really busy with all the recovery work, and at the end of the year, their manager completed a review of the year and just send it through as if they'd had a conversation. And I think that was quite damaging to the individual to feel that a box was ticked, their manager looked like they completed it. But some caution, and I don't know how we get under that. But yeah, just that it's that closing the loop of does it, what we're intending and what we're tracking, is it actually landing at that real local level? And the broader comment was just that I wanted to acknowledge the honesty and transparency around the results. I think it's a difficult one this year because I can see some real improvements from where we were last year, which was quite a sorry place to be as an organisation and for people working for CQC. So I really do want to celebrate some of the wins, but there is still some real concern in results. But the way that this has been presented at board papers, I think, is markedly different from previous years. There hasn't been a glossy sort of veneer put over it, and I think really being honest at where our problem areas are will be really appreciated by CQC colleagues. Thanks.
Thank you. Ola, I'm going to bring you in. The only thing I'm going to... No, that's all right. The only thing is just we're a little bit ahead of time. We've got two more really... I mean, that's a really important item. But we have got... Aaron's going to briefly talk about turnaround. He's also going to talk about some bits on the external landscape. And we have had 3 questions for the public and 1 deferred from last time, which I would just like to get to if we can. So, but if there is anything, I'll just bring us back to it's 4:15. Is there anything else on that item? No. Thank you, Chris. Very live conversation. We've got one in 10 days about assurance around the CQC way. This will keep going. And thank you, Suze. I think hopefully you'll see the transparency is something we really, really want to have here. Aaron, I've shut everybody up. Time for you.
And I will be succinct on this one. And actually, it's interesting. We've set it as a separate agenda item to make sure that we give it the prominence that it deserves. But it's been threaded through pretty much every conversation today has been around turnaround. I just want to kind of just overarchingly, we did the work around stabilisation, those 4 immediate priorities and 5 foundational improvements, recognise the work that's gone into getting to those metrics as we set out before. We're now in the place where we need to look at broader turnaround. Where do we want to get to and deliver and enact on that? As I've said before, it's 4 quadrants. It's about the people, the culture within the organisation, recognising that needs to change, as well as our productivity, quality, the value for money that we demonstrate. That's important in our performance. Making sure that colleagues who are doing the inspections and doing that activity are so well supported with the right tools to do the work. There's a lot of work that we need to do on that to get those things done in the right time. And then we've got to kind of look at our role in the landscape. How do stakeholders perceive us, which is some of the work that Richard and I were both commenting on what the external strategic advisory group were telling us. So we've got to make changes and demonstrate, and that was the other thing that came through. There's a window of opportunity. We have to really seize on that and deliver for patients, for people who use services, and for providers so that we can support them on their improvement journey. I will stop there on turnaround.
Thanks, Kay. Just one specific element of turnaround I just wanted to call out because it is alive and kicking. We talked earlier about our new assessment frameworks. We are currently seeking views on the detailed content of those, and tomorrow we'll be publishing our approach to piloting and evaluating our new assessment frameworks. That will go live tomorrow, so colleagues and providers and others watching this, please do look out for that. Obviously, that the rollout of our new assessment frameworks or how we adopt them internally very much relies on our digital systems, and we are having now live conversations as to when we will be able to start rolling out our new assessment module and at what point we will have fully adopted our new assessment frameworks across all of our sectors. Obviously, that will be the subject of future board meetings and will require us to carefully communicate and engage with our provider colleagues. But I just wanted to talk about that as work live in progress. Thanks.
If I can press you on that, do you think we'll have a very comprehensive update at the next public board?
I can provide an update. So yes.
We're taking this work forward through that sort of business planning, prioritisation, the metrics. So that there will be an update, and we will have kind of clear metrics that we can then set out to the board. And we'll be, really looking forward to getting to this session of business planning, because we'll be discussing this with colleagues around the metrics that we're setting and what turnaround actually tangibly looks like for across the organisation. Thanks.
And just to finish, I'd just like to say, I think board members, we're all aware there's a huge amount of effort going into this. There's a lot of very live conversations to try and get some of that clarity that people seek, and the board are investing more time to ensure that those conversations happen at pace, so that we can get there. And I'd like to thank everybody for that extra effort and investment that's been put in. External landscape.
Thank you. This is a really exciting paper. I hope. We've been talking a lot about the work that we're doing internally, so that we're delivering on some of the key functions that we do as a regulator. But it's quite right that the health and care landscape expects us to be a regulator that makes a difference across a number of areas. This paper sets out various areas that we're working on with partners, that we've been asked to take a role on. There's various different things within the health bill that Bola's already spoken about one of those. So it sets out some of the asks from the external landscape that we're responding to, all at the same time whilst we're working on this turnaround. I'd just I've already mentioned some of the things from the health bill. I would also mention events regulation, which is a kind of key area for us, and the registration of those organisations and the time frame for that. And we've also, and Tolly's spoken to this earlier, about how we provided evidence to the AMOS review, and we're really kind of keen to make sure that we're making a difference in that space as well. But yeah, neighbourhoods, so many areas. It's a really kind of exciting paper to see all the areas that we're intervening on. Thank you.
Any questions from anyone on that? I'm sure we're going to see more of that in future board meetings. Lots there. No? Okay, any other business from any board members? No? Okay, as I say, we had a question last time, and we didn't, the responsible chief inspector wasn't available to respond, so we've deferred that from the last meeting. But if I could read the questions out, and thank you for people to put in questions to us. It's part of us listening to the public, and we are really curious about this, so thank you to those who submitted questions. How will the CQC ensure there is public and carer involvement during local authority assessments? And I think, Chris, you're going to take this.
Thanks, Kay. Yes, and we've been doing local authority assessments just for colleagues' benefit of adult social care functions over the last 2 years. A couple of things we've been doing already that I'll just outline. Firstly, obviously, we engage directly with community groups, voluntary sector organisations within the local authority area, both during, before and after those assessments. We do track individuals' journeys through an adult social care system, where we think it's really important to understand how they interact with the local authority, with professionals, and how that works. I think the thing that struck me most, that's been most impressive, and I've had personal experience of this, is that we do use experts by experience to engage with unpaid carers in particular. So I've done work with the unpaid carers that we commission, who I think get a much better sense of unpaid carers' experience through their work and empathy that they can sort of show with unpaid carers in terms of understanding the experience that unpaid carers in the given area have with their local authority. We also review and assess how well each council engages with their communities, and, for example, how co-productive is their work, and I think that's really, really important. As we move on to our next stage of local authority assessment, so going beyond the sort of baselining period, this is an area where we're looking to do more on. We've got work where we're going to be doing ongoing engagement with community groups, not just when there's an inspection. We've introduced sampling of people's experiences through reviewing records alongside local authority staff, so not case tracking, but actually going into systems, bringing people up, understanding their experiences. More work on unpaid carers, which I think is really, really important. And I think it's also important to say, working with care providers in a given area about experiences they may have with the local authority and speaking to people in receipt of care and support services that they care for too. So looking to build on what we've already done, but we think it's a really important part of both the methodology and the assessment framework that we have with our local authority work. Thank you.
Thank you, Chris. The second question is, how can CQC improve its response times to expression of concern that have been received from members of the public? So we touched on a little bit of this in the performance report, but I think Tolly, you're going to answer this.
Yeah, thank you, Chair. And as you say, we did touch on that, and we do have specific targets around responding to those areas of concern, which are very serious in relation to safeguarding potential criminality and so on. But in terms of sort of the broader receipt of expressions of concern, so these are still a really important source of intelligence for us because they help us identify risk and protect people who use services. But what we cannot do, what we're not empowered to do as CQC, is investigate or respond to individual concerns, and we just don't have those legal powers. So what we do with that information, aside from the safeguarding and sort of potential criminal issues I've mentioned, what we do with that is it informs us in our ongoing monitoring of services. It may even trigger direct contact with a provider or more rapid inspection or urgent review. We have the power to share that information with other regulators, such as professional regulators or other service regulators. And we can also signpost the individual who sends us that concern to other organisations that can better help them individually. Because there's such a range of things we can do, we don't therefore have a particular standard in terms of time for when we deal with that. But if a concern is raised about our conduct as CQC, then we do have a standard to resolve that within 30 working days. So it's obviously really important that the public have the opportunity to raise that and that they know what we're doing that. So we welcome such questions. We want to continue to improve how we communicate and also be clear about the limits of our role, but support complainants to signpost them the right way. Thank you.
Thanks, Tolly. And now we've got a couple of questions which I think Bola's going to answer. First one is, what targets does CQC have for the frequency of inspection of GP practices and dental surgeries?
Thank you, Chair. So in terms of the frequency of inspections for all the sectors that we regulate, the frequency of our inspections depend on the information we receive, the evidence that we collect. Inspections may be planned. In some instances, they could be responsive. So, for example, building on Tolly's point, where we've received concerning information, then we can carry out a responsive inspection in those circumstances. There's more information on our website about the frequency of assessments and inspections, and that's published on our public-facing website. We're currently operating a national risk-based approach to inspections, and last week we published our priorities for delivering more assessments and tackling aged ratings. I do signpost people to have a look at that. It sets out overall and also by sector how we prioritize our inspection schedule. And I think that's the most live document that we have in that regard, and it was only published just in the last week or so.
Thank you. And when inspectors visit GP practices, how do they assess the availability of GP appointments for patients?
So our current assessment framework, one of the 5 key questions is around how responsive services are. And that does particularly ask whether people can easily access care, support, treatment, particularly in ways that meet their individual needs. And so we look at their circumstances, including needs in, like protected characteristics. We have a quality statement that specifically asks about equity of access within our current framework. So that's one way that we look at that. So our expectation of providers is to ensure that everyone can get the care they need when they need it. But to also say, especially, that we regulate against our standards. So, we do not regulate against NHS performance metrics. So when people look at what we do, you won't hear us talk about how many patients should be registered with a particular GP, how many appointments should be offered, and so on. What we do is look at those regulatory standards and our providers delivering against that. And I'll signpost again to another article which is on our website about access to GP services. It's a myth buster, and it just gives further clarification around how we approach those issues.
Thank you very much for everyone for answering those questions. And I'd just like to thank everybody for, we've covered a huge amount of ground in this board meeting. Thank you for the honesty, transparency and the challenge from everybody. Our next public board meeting is on the 16th of September, but I'll say good afternoon for now.